A ChiroSecure research update. A study published in the journal BMC Musculoskeletal Disorders determined if changes in chronic low back pain, as measured on a verbal rating scale, before and after a 6-week treatment period with non-surgical spinal decompression, correlate with changes in lumbar disc height as measured on computed tomography CT scans. The study included 30 patients with lumbar disc herniation with an average age of 65 years, 21 females and 9 males, and an average duration of low back pain of 12.5 weeks. During treatment, low back pain decreased from 6.2 to 1.6, and disc height increased from 7.5 millimeters to 8.8 millimeters. Increase in disc height and reduction in pain were significantly correlated. Non-surgical spinal decompression was associated with a reduction in pain and an increase in disc height. The correlation of these variables suggests that pain reduction may be mediated, at least in part, through a restoration of disc height. A randomized controlled trial is needed to confirm these promising results.